Okay, so your question, mean old Dr. Rutledge, you son of a gun. You're taking away all our pain medicines. I mean, you're not giving us pain medicine. What kind of doctor is this? What happens if I get a sunburn, a stubbed toe, a twisted ankle, bad headache? Well, let's talk about that. But let's begin by saying I don't want to take away your pain medicines. Okay, I don't want to do that. But let's look at all the pain medicines that you could buy at the grocery store, okay, or at Walmart or Walgreens. All right, you could buy aspirin. Well, aspirin causes bleeding ulcers. You could buy Motrin, Aleve, Advil. There's some prescription medicines like that called indomethacin. They're all drugs which, like aspirin, cause ulcers, bleeding ulcers. Okay? And then there's Tylenol, which recently a committee of the FDA recommended that it should be taken off the market because it's now the leading cause of liver failure and death and liver transplants in the United States. So all those drugs are mild pain relievers. They're mild pain relievers. So for people who have serious pain, we almost never recommend, if they have a broken leg, that they take a Tylenol. For people with serious pain, we recommend basically narcotics, like we talked about earlier. Narcotics are wonderful drugs, but they have some side effects. One is you can't take them forever because you get addicted.
Sure.
So for our patients, what do we recommend? Well, first of all, we want to constantly alert you to the fact that our surgery, like aspirin, causes bleeding ulcers. I don't want to say that. I'm not happy about it. I'm disappointed. And I wish that we all lived in kind of fantasy land where this surgery had nothing but good features, nothing but benefits and no downside. That's not the case. There are risks from the surgery, and risk number one, the most serious, most common complication that we see is a bleeding ulcer. And in fact, the rate of bleeding ulcers that we get very close to the same rate of somebody who takes a baby aspirin every day for a year. It's about 5% of our patients. That's the same as an aspirin. Okay? If that's the case, do you want to put an aspirin plus our surgery together? No. No. And we know that because people have done it. And they get a perforated ulcer or a bleeding ulcer. Do you want to put our surgery together with alcohol? No. Cigarettes? No. Soda pop? No. Okay? So then you can ask, well, Dr. Rutledge, so what am I supposed to do? And you kind of mentioned the answer, which is for mild pain, a headache, a sunburn, a stubbed toe, we have no good answer. You have to tough it out. And what you need to think of before the surgery is to ask yourself the question, is that a fair trade? If I get rid of my sleep apnea, my high blood pressure, if I can play with the kids, if I can throw the football, if I can run around, is that a fair trade-off to lose out the opportunity to have Tylenol for a headache? And you have to weigh that. My opinion is when I hear other patients, they say that's a fair trade. To get rid of my diabetes and give up a Tylenol for a headache, that's fair. And there's also another trick to it, and that is most of our patients have fewer headaches after the surgery. They also have less knee and joint pain after the surgery. So overall, if you ask my patients of their two lives, their life before surgery, when they had access to every drug in the drugstore, and their life afterwards, where I've taken away all those drugs, which life had less knee pain? Which life had less headache pain overall? Which life was more enjoyable? And which life would they want? I hear over and over again, I'm happy to give up the Tylenol if I get this life. And there isn't any perfect solution and answer to your question. Your question is right on target. It identifies one of the severe limitations of the surgery. I'm taking away, in my recommendations, all the drugs in the drugstore for pain.
What about a case, I mean, like I said, and hopefully like the surgery, it becomes even less so, but you know, every once in a while, maybe 2 or 3 times a year, you get one of those migraine headaches where it's just, you know, it almost puts you down.
Sure.
Is there something you would recommend?
Well, for migraine headaches, the first thing to do, of course, see your doctor and see if there are some special migraine drugs. And those drugs I would discuss with my doctor, and my understanding is they don't cause ulcers.
Okay.
The other thing is for a severe pain, let's suppose you're shot with a gun. You're dropped out of a building. You're run over by a bus. You're set on fire by terrorists. Okay? I have one word for you. You know, like from The Graduate, I have one word for you. Narcotics. Yeah. And narcotics are wonderful pain relievers. You can't use them every day. So for migraines, the other good news, though, is if you had 5 migraines last year, after the surgery, you're probably going to have 1.
Yeah.
So overall, the trade-off from our migraine sufferers, when they talk to me about this, they say that even though they had all the drugs in the world pre-op, they prefer living with their headaches post-op because overall, they have fewer migraine headaches and they're less severe after our surgery. So again, it's not perfect, but overall what we hear is headache-wise, they have a much better life after surgery even though we pulled those medicines. And if you have a devastating pain, whether it's a headache or anything, a short dose of narcotics is a wonderful choice. The problem with narcotics is you can't use them every day. But on the other hand, that wasn't your question. If you have a terrible, devastating headache, see your doctor and discuss with him or her the medicines, and probably the best thing is going to be that migraine medicine maybe, or a narcotic. Now that gets into another question. Dr. Rutledge, what drugs are safe? So there are about 2 million drugs. Okay, so how about if I just give you a list of the ones that are safe? That would be hard. So here's what we recommend. Let's suppose you go see your doctor tomorrow, and he says, oh my goodness, you have disease X. And I want you to take drug Y. Now you can call me. You're always welcome to call me. You know, forever you can call me. But I may not know much about all these different drugs. I know a few about the drugs that I use, but there's really a lot of drugs out there. And you saw it this morning. I didn't know what Texturna was, right? And I didn't know what Diacirc was. So you can call me about Texturna. I'm not going to be a good resource. Here's what we recommend in the future for you after the surgery. Remember, you're worried about your liver and you're worried about bleeding ulcers. So if your doctor says take drug Y, turn around to the doctor who's prescribing that drug and say, do you know what the side effects of this drug are? What are the risks? Just like I tell you the risks of the surgery. He or she is probably going to know the risks of the drugs that they prescribe, otherwise they wouldn't prescribe them. Especially ask them, does it hurt the liver or does it cause ulcers? That's step 1. Step 2, talk to your pharmacist. When you're picking it up, say, I want to talk to the pharmacist. What are the side effects of this drug? What are the risks? Does it cause ulcers and does it hurt the liver? And then step 3, Google it. Okay? When you Google drug Y and it comes up, call the law firm of so-and-so and so-and-so and so-and-so, if you've had a bleeding ulcer from this drug, that's a hint. Is that kind of...
That's good.
Okay.